Hello, my name is Dr. Sharisse Stephenson, and I'm going to speak about my experience with fibroids and uterine fibroid embolization. I began having fibroids about 10 years ago. It was noticed just during a routine well-woman exam. I didn't have any symptoms at that time. However, the gynecologist recommended either an open myomectomy or an open hysterectomy and informed me I would need to take 6 to 8 weeks off of work. At the time, I had just opened my new neurology private practice, and the thought of taking 2 months off of work in my brand new practice just was unfeasible. So I didn't have any symptoms, so I just didn't do anything about the fibroids. However, as the years progressed, I did become symptomatic. I began having back pain, bladder issues, and then severe anemia. I really thought I was dying. I couldn't walk, I could barely work. I had to decrease my hours to work to barely part-time. I couldn't dance. I couldn't do anything. I couldn't even bend down and tie my shoes without getting out of breath because of the fibroids. And by then, I was just miserable. I went to several doctors to talk about surgical options, but several of the doctors felt uncomfortable due to the size of the fibroids at that point in time. However, one physician did refer me to the Fibroid Institute, and I'm so grateful for him for that. I met Dr. Slonim at the Fibroid Institute, and she looked at my MRI and told me that she could help me. When she told me that, I just wanted to cry. I was so grateful that I could finally get some help. I was willing to do anything at that point in time. So I had the uterine fibroid embolization. It was a 1-hour procedure, and I immediately noticed improvement as soon as I got up from the table. I was able to bend down and put on my slippers and not get out of breath, and I couldn't believe it, and I was so excited. So I ran, hurried up, and put on my clothes so I could get out of there because I felt great. Dr. Slonim tried to tell me to take it easy, but when you've been suffering for so long and you feel you can move and you can breathe, it's just hard to. And I felt great when I went home as well. I was able to walk the dog. I was able to walk around the house and do housework. She did call me to check on me after the procedure, like she does with everyone, and tell me to take it easy, but I just felt so much better. And I continued to feel better. I didn't have any pain. I think I took one pain pill 3 days afterwards, but I felt better than I had in years. And I've been able to go back to work. I've been able to travel again. I've been able to line dance again. I'm able to now devote myself to my practice and go and travel to other communities that need neurologists. And I'm starting satellite clinic in underserved rural areas in Texas. And I couldn't do anything when I was suffering from the fibroids. So I feel very strongly and passionately that women need to know that this is a treatment option. I'm a physician, I'm an experienced physician at this point, and I did not know about this. I just suffered and suffered, and I did not know that a simple 1-hour procedure could have brought me so much relief. All the women in my family have fibroids. Unfortunately, fibroids really disproportionately affect African American women. And in my family, every woman just suffers until it gets so bad that they have to have a hysterectomy. And I don't think that fibroids have to take people's lives away from them anymore. So we have a nice non-surgical 1-hour treatment option where you can be off of work 1 week. So I really hope that more women can know that this is a possibility. If you're in Texas, the Fibroid Institute now is in multiple locations, and the doctors are great. So I encourage you, or if you have any loved ones or friends suffering from fibroids, to reach out to the Fibroid Institute if they're in Texas. If you're not in Texas, then I really encourage you to find an interventional radiologist that's experienced in uterine fibroid embolization in your location. Women don't have to suffer just for fibroids anymore. And I'm very glad to share my story. And I love the Fibroid Institute.